Hi, I'm Kelly Beasy. I'm a nurse practitioner, a clinic owner, and an aesthetic medicine educator with HealthCert Education. Welcome to the Aesthetic Shift, a HealthCert Education podcast for cosmetic practitioners looking to evolve, diversify, and future-proof their aesthetic practice. In each episode, we're going to explore core cosmetic topics like treatments, complications, and ethical marketing, along with complementary areas that you may wish to add to your scope of practice, from women's health to skin rejuvenation, gut health, weight management, and more, to help you broaden your offerings and build a more sustainable and resilient practice. So let's dive into today's topic. Today, we're going to talk to Kelly McChord. Kelly McChord is an endorsed nurse practitioner based in Perth. She specialises in women's health, skin health, and wellness, as well as minor dermatology and cosmetic medicine. She holds a bachelor degree with honours and a master's of nursing science. She's completed postgraduate certificates in both menopause and skin cancer medicine and has over 15 years in the aesthetic industry. She's a clinical trainer with Mertz, and she owns a clinic called the Glasgow Skin Clinic in Perth. She has grown her solo operator business to being multiple staff members and is looking at currently adding a second practice. So we want to dive in with Kel and talk about when is the time to grow and scale your business, when to add devices, what sort of devices, and any tips and tricks of things that she's learned along the way, what she would do better in hindsight and what she wouldn't do. Welcome to the podcast, Kelly. It's great to have you.
Thank you for inviting me. I'm delighted to be here.
Yeah, it's great to see you. So, Kel, just tell us what motivated you to get into aesthetics and to move from being a solo practitioner, which I know you started, to growing a business.
Well, my motivation, I was always worked in the ED and in the resuscitation space. So as a resuscitation training officer, that's easy for me to say. And I always remember there was this little old lady came in and she was wearing like a twin set cardigan, pink twin set cardigan, and she was dying and she just wanted her lipstick. And all my colleagues round about were running about trying to basically, resuscitate this elderly 90-year-old lady. And I just thought, give her the lipstick. And that actually changed my mindset a lot with regards to, you can deal with that acutely unwell patient, but sometimes we have to be thinking about other things that give people, like, that make them feel healthy or feel confident.
So there's the lipstick effect from during the war, right?
Yep. Yeah, absolutely. So that kind of resonated. And then I spoke to my husband and I said, I'm going to do this wrinkle relaxer course. And he was like, no, you're not. You have 4 children under 6. You're doing far too much. So just despite him, I just done the course. And I was terrified the first couple of patients, absolutely terrified because there was no support. It was me on my own. And then I waited a year and got more confidence and competence in wrinkle relaxers. And then I embarked on a dermal filler course. And for me, that was the best way to gain my own confidence in my injecting ability, facial assessment, etc. So yeah, that's what started it off 15 years ago.
Yeah, things were very different back in the day, weren't they? So
Absolutely.
how did you go from being solo practitioner, just doing tox, just doing fillers, and now you're about to embark on clinic number 2? How was that progression?
So moving from the UK to Australia, not that I'm going to be dogging anybody, but in the UK, we didn't really have a good support network amongst the nurses. And so when I left Australia, I thought, I'm just going to get a single room. I'll work in a GP practice, and I was then endorsed as a nurse practitioner. And I kind of was like, I don't have to do anything. I'll just go to some training and keep my online competencies. But then you get lonely. And you actually start to see, that you're missing out on things and you're not collaborating and you're not growing. So I was in that clinic for 7 years, and I had another little boy in that time, number 5, so that worked fine. Then COVID happened.
Yeah.
So, and then after COVID, again, I said to my husband, right, I'm going to open a clinic. And he was like, why would you do that? Look what just happened. The world just come to an end. And I was like, no, it's time, because I feel like personally for my growth and development, I need to have that expansion. So then we had this clinic for 3.5 years. And then in the last 6 months, we've outgrown the clinic and we have expanded and we've just bought a second premises nearby.
That's great.
Thank
So
you.
at what point in this journey did you feel you were ready to take on another injector or your first staff member? And what What sort of things did you think about when you were hiring staff? Like, what was the signs that it was time?
Yeah, I think the first thing I would advise people is you have to get your own portfolio first. You have to build up your own clientele. And that's the most hardest thing. There'll be days where you could have been paid in a hospital job or general practice or whatever, primary care, and you'll be paid hourly. And then there's some days that you sit for 3 hours and you see two patients, or there's an hour and a half between two patients. And so I think that people, when they enter the industry, they think, I'm going to just be super busy straight away. And clients are attracted to different type of people, so you're not going to be attractive to everybody out there. And so I think, like I said, yeah, go and build up your own portfolio. And then I then noticed that I might be needing a second room, or like days that people wanted me. So I already worked in ED. I still worked in ED as well. And I would do, say, like Tuesday, Thursday, Friday, but people were wanting to book in on a Wednesday. So I employed a nurse and trained her for 2 years, and then she worked on the Wednesday. She shadowed alongside me, and then she was able to work on her own on the Wednesday. And the expansion of that as well was that when you start to want to upgrade patients' treatments, like for example, you want to put on a face mask or put them under the LED, then that's going to hold you back in your appointment time. Then your patient's waiting for you. And I think we always have to be aware of what your patients expect of you. So some of them have finished work early, taken the day off, got babysitters, that kind of thing. So it's really important that we always think of the patient's journey and how it's going to appear to them. So then that was why I took on the nurse so that she could do extra patients and extra treatment times.
Yeah. So essentially, you had built your client base and you were busy enough that you needed that extra person. You're valuing the customer's time, the client's time, that you could multitask by having a bigger space. And then did you get admin support straight away, or did you wait with admin support and practice management?
Well, that's a really good question because I feel like, admin are now in my business, like I couldn't do without them. Like if we have a sickness or anything, it's really hard to manage, again, for the patient experience. But I actually just utilise my nurse in the admin space because the nurse can do admin, but the admin can't do nursing.
Mm-hmm.
So you can utilise that and train them up on your clinical software and your pricing and your marketing. And yeah, that's what I would recommend initially.
And I guess while that second injector is building up their client base, they've got a little bit of space and a bit of time. Because as we both know, it takes a good couple of years to get busy in this industry. Like you said, it took you several years to build up from, nothing to a busy clinic to have a second person. So what about devices? I know that you have a couple of devices in your clinic, some really exciting ones. When do you think it's a good time to add a device from a business perspective? What did you do and what would you recommend?
So I was lucky enough to be kind of mentored and taught in Scotland. And I remember a doctor from Edinburgh, I was, I thought she was great. And I was like, you've got all these devices in your clinic. And she said to me, Kelly, the only tool you need to start are these. So I'll always remember that. So at these and these.
And your hands in your eyes, yeah.
Oh, yeah. So she was like, one, you need the patients. So the market's saturated just now with devices. And I feel like, I'm overwhelmed, so I'm pretty sure that most people feel overwhelmed. And because of the restrictions on advertising, so we can advertise these devices. And so I feel that a good thing is that most people are focusing on skin and skin health, whereas before it was just like that plump and dump. So patients would have big lips and cheeks and really poor quality skin, whereas now we're kind of doing that more holistic thing. But yes, my advice would be, speak to a few of the reps of the different companies and tell them what you need, tell them your patient demographic, because they'll sell you what they want to sell you, which doesn't necessarily fit your demographic. If you had Fitzpatrick 5 and 6 patients, then most devices not going to suit you. We started off with a kind of multi-platform. It was a 12-in-1 modality, which had hair, IPL hair removal, IPL skin rejuvenation, laser tattoo removal, carbon Hollywood facial, some radio frequency skin tightening, and ultrasound body contouring. And from there, we just, that we just made sure that we were using that every single day.
Yeah.
Because that's another thing, we see it all the time, new businesses, and they might have some money to invest in their business and they buy big, expensive machines. But you have to think of your return of investment and, when you want to get that return of investment. So if you say, okay, I'm going to wait 3 years to get it, then, okay, you can turn your device on once or twice a week. But if you want that back in a year, you have to be using it every single day.
That's absolutely.
So I feel like if you get one that has all of these modalities, then you have got more opportunity to be using it every single day.
Yeah. So you identified with your injectables that there was that little gap in your offering for skin. And so you sort out what would fit your demographic of people,
Yeah.
but then you got an extra clinician in to operate the device so it didn't take away from your injecting, or did you operate the device yourself initially? Like, how did you manage that kind of logistics of it?
Yeah, so by the time that we had the device, we had 2 nurses with us. So the 3 of us done the training, but it was very much so that, it'd be more the nurses that would be doing the treatments. And now we have a dermotherapist, and it's certainly mostly the dermotherapist that does the treatments. Because like you said, some of the energy devices, they don't pay as much. So you have to be making out, you have to work out what you want your hourly rate to be. And how you can maximise that. Now, obviously, we're all health practitioners, and it is about the patient, and this is a vocation. But when it's your own business, you have to be covering all your overheads and paying the bills. So I think that would be that's a good way of doing it. And making sure, the other thing that I would always say is making sure that you're really confident and competent with that one device in that one area. Because I feel like, there's jack of all trades. And if you buy 6 different handpieces for your laser or, a big laser platform, then there's no way you can get competent in doing that unless you've got, 100 models ready to allow you to do so. So it was at the forefront of a big priority for us, is to make sure that each of us were happy, confident and competent to use the device. Yeah.
And that it fit a niche in your clinic, right? Like you want that machine to be busy, like you said, being used every day so that you can pay off your return on investment. So making sure that device services the client base you have.
Yeah, and I mean, and that's kind of how the cosmetic industry goes. You do start off maybe with the talks and fillers, and then you're like, oh, actually, I really would like this, because your patients say, do you do this? Or what do you think about, this telangiectasia here? And you think, well, actually, I have nothing to treat that at the moment. And then when you have 4 or 5 patients saying, with rosacea or telangiectasia, you think, oh, maybe I could now introduce a device that treats that. Or the other thing is, you can do small audits and you can just ask patients like, oh, I was thinking of buying, say, a HIFU device. Do you think you would be interested in that treatment? And that can be a little kind of bit of research to see whether it's going to be worth it.
Yeah, that's a really good tip actually, is to do a little survey of your client base and see what's their biggest concerns, and then do your research into which device is going to address the main concern that people have. All right. So the next kind of question would be around when you're about to move into your bigger space at your second location. What sort of business metrics or clinical indicators drove that decision? What was your guide on when is it time to move to a bigger clinic? And then what are the business metrics that you kind of keep an eye on?
So really, patient growth is our main metric. We're watching the new patients and what they're looking for. And when you can offer a few different things in your clinic, we want to serve them well. We want to make sure that it is the right space for them. And that's why I felt that we'd kind of outgrown our space. Like, I don't want my waiting room to have, 6 to 8 people sitting there. I want it to be a little bit more bespoke and boutique. And so the clinical indications were that, as you open up your doors to different holistic health areas, so, moving forward in the next 5 to 10 years, I feel that the cosmetic industry will change a lot, and it will go towards, I don't really like the word wellness, but what it means is to be well. And so that's kind of what changed with our clinic and drove us towards the new clinic, was that patients were coming in looking for other, things such as weight loss management or women's health or men's health. And thankfully, my husband's now on board and he's a GP, and we had the expertise to deal with that. And so that's what's been driving us towards the new clinic.
Great. So it's only taken you 10 years to get him on board with this clinic.
Well, we've been together for 27 years. So
getting there. So this new clinic, obviously, tell us about the new clinic. How many rooms are you going to have? How many staff members do you envision? What sort of services?
Yeah, so my husband has been performing skin cancer treatment and management for about eight or 9 years now. And so this was kind of how I was recognising, and I'm sure you do too, recognising a lot of skin cancers in the cosmetic space. And then I went and done my professional certificate, completed my professional certificate through HealthCert in skin cancer medicine, which was great. And I was then able to do the biopsies. But then if there were big excisions, I was sending them to my husband. Or prior to that, before I'd done my qualification, I was sending them to a GP. They'd come back 4 months later for their talks and they still had that lesion on their face. And it's more difficult to manage. So that's why we got into the skin cancer space. And so that's definitely going to be a big area in our new clinic. So we've got one room just for the mole mapper, and we've got 4 consultation rooms, a treatment room, and then a cosmetic treatment room. So I'm not very good at this, but I think it's about 200 square metres.
Excellent. And how many staff will you have?
Well, we anticipate what we're doing here is we're going to keep this more a sort of cosmetic and dermal hub, and that's going to be the sort of health hub. So I anticipate that we'll definitely we're going to have one of our nurses is going to be the nurse manager. We'll need at least 3 or 4 reception staff, and we'll need 2 more nurses because the doctors that we're going to be employing there as well always like to have a nurse to assist. I have 2 female GPs in the picture, and then a male nurse practitioner for men's health.
Excellent.
So quite a few.
Congratulations. So you've gone from being a solo operator with your toxin and then adding your fillers and then devices, and now having this second health hub, which is really exciting. So how do you currently, or do you plan on balancing being both a clinician and a business owner in this space? So I guess, how much of your time is spent doing the thing and being the clinician and versus business owner, and what's that balance look like for you?
Well, I'm not going to lie, it's the hardest part. And I think we know each other, like in those type A personality we're very difficult at delegating. So I am getting better at that. But if anybody goes into this thinking that it's going to be just easier than going to their job and getting paid and, getting an early salary, or there's a lot of that in this space at the moment. There's a lot of cosmetic nurses and doctors that are doing it because they're like, I just want an easy life. It is not an easy life.
Nothing easy about it.
There's nothing easy about it, and you never stop working. So actually, when I was talking about earlier on doing that hourly rate, that's when you're actively clinically working. That hourly rate probably drops to $10 an hour if you click all the other stuff that you have to do. But delegation is key, and nobody, you don't need to be a martyr. Nobody really cares how much you work for your own business. But what we need to do is we need to make the patients feel valued and that they're our most important part, even when you're tired.
Definitely. So have you been decreasing your clinical hours and increasing the business hours, or are you putting trusted people into those business positions for you?
Yeah, at the moment, I've reduced my clinical hours a little bit. Like yesterday, I was home and I probably spent about 8 hours on the computer. But that will need to be delegated because, basically I am a clinician. But at the moment, that's okay because I have others that can fill in. So I have my 2 nurses, and Stephen can also see some of my patients. So we're not really noticing it that much. But I think you have to make sure that you need to know that you're going to be time poor.
Yeah.
Or for a certain amount of time. until you can delegate effectively to the right people.
Mm. And I guess that's a really important lesson that takes a while for us to learn is how to delegate, when to pull back, when to move
Yeah.
into doing, otherwise you burn yourself out and there's no time for you. So I guess our next that leads into the next question is about mistakes. Like if you look back at the journey so far, is there anything that you think I shouldn't have done that, I would have done it differently now, that you've maybe overstretched, both from a clinical perspective, from a business perspective, or even from a leadership perspective?
Yeah, definitely. Like, and I think that if anybody's set up a business and they don't think they've made mistakes, then I want to have a word with them because they can give me some advice. One
Yeah.
of the main things that I wish I'd done is that I'd done it sooner, to be honest, because I
Yeah.
did have a really good client base and I was just quite settled where I was. And, so that was a major thing.
What held you back?
Just I think probably the fear of failure, probably. And financially too, that you know that you have to really invest in this. And my husband's uncle is a very great businessman, and he'd always said to me, don't get loans, try and do this without it. Then as your business progresses, then you can get loans, but try and set it up. So that was kind of my aim, was to set it up without getting into a lot of debt. That was definitely other things, simple little things like not taking booking fees at the beginning. And then, you've got you and your nurse in the clinic and patients don't turn up. And it's that those kind of financial things are not, as health professionals, are not good at that. We're not really that good, when most of us, at asking for money, because especially coming from the NHS mindset, we're not really good at asking for that. So that was hard for me. But then once you realise, you know what, the ones that I let away without paying a booking fee are the ones that won't turn up.
Yeah.
So
You didn't need those clients anyway, right?
absolutely, and you realise that the ones that you keep making allowances for are your red flag patients.
Mm-hmm.
And I'd say in our clinic we've got probably 97, 98% of my patients are great, and then there's a small cohort that can be problematic, and so if they don't value your time for, say, a $50 to $100 booking fee, then you don't want that patient.
That's
And
true.
that's something, and I'm sure you, Kelly, I would point out, is to new, sorry, I keep going off that screen, going the wrong way. New injectors is, value yourself and your worth,
Yeah.
and price that accordingly, because if you start off low, it's very hard to, and I'm guilty of that. Like, I'm guilty of, when I moved to this clinic, my reception staff were like, Kelly, everybody thinks you're their friend, and they're like,
Yeah.
Kelly only charges this, or Kelly gave me
Yeah.
a review for free, and so it was quite hard to start again. So
Yeah.
yeah.
That's really hard to come back from, because you do want to look after people as a nurse or as a healthcare professional. You want to give people the service, and if they can't afford it, you really want to help them out there. But like you say, you've got to value your knowledge and your skill. And I think there's a lot of competition in this industry, so there's a lot of not pressure, but there's a lot of people that have the idea that I'm going to come in with a low price and that's how I'm going to build my client base. I'm going to get people in with my price, but it does attract the wrong type of clientele potentially, and it is very hard to scale with a low cost point, because you've got to seek double the amount of patients for the price, the return on business, and your business fees remain the same. The rent is the same, cost of goods is the same. All right. What about from a leadership perspective, like growing a team and stepping from being a clinician into being a manager, doing HR management? Is there any tips or mistakes that you want to share?
I just try and think of myself as an employee, and would I want to work in this clinic? So
Yeah.
I'm more, and I make sure that I'm constantly asking, are you happy? Is there anything you'd like to change? And I wouldn't say, I'm the perfect leader, but not at all. And you're constantly challenged in your leadership role as the business owner. But I think, like, being really honest with your sorry, not your patients, your employees and your staff, and transparent with why you want to make changes in the clinic. Like, we're going to be changing this at reception because of this, so that they don't take things personally. We have a WhatsApp group where we put everything on there. I try and be really open with my nurses, and I have got a really good relationship with them.
Right.
And in fact, my senior nurse a couple of years ago, I said, come to me about anything. She came about a few issues in the clinic, which were quite easily fixable, but I actually think she was thinking of leaving at that point.
Okay.
Just because, it's hard for her to come and criticise your organisation when it's a small clinic. It's much easier when it's a massive clinic with 20 staff, but when it's only 6 of you, it's much more difficult. I've had a few issues with reception staff that I've had to let go, and I definitely would review how I dealt with that. Just from a PR point of view. But it's never easy to tell somebody that their performance is not up to spec, so nobody's ever going to take that. And it's funny that my current practice manager, she gets all the crap over the phone from patients, when their booking fee's been taken, and then they'll try and speak to me and say, I didn't like the way she spoke to me, and I'm like, but you don't it's not the way she spoke to you, it's what she told you what was going to happen, as in your booking fee's been cancelled because you didn't turn up. So
trying to support your staff, but also keeping those relationships good with your clients is a really tricky role. Being the middleman, that's a hard one.
And also is when you're trying to build up the nurses clientele, your patients only want to see you. So, they'll come back and say, I don't think she's as good as you, or I don't think, and that's not necessarily true. It's just the way you make people feel. So they're not, you might not be any better than them. So it's trying to, convince your clients. I'll say, well, everything they do is because I've taught them that, or we've sent them on courses, and we offer them courses regularly because there's much better education out there now. So, we're trying to promote their professional development, and I think that's really important too.
Absolutely. So when you came up across those roadblocks, I guess, where the clients didn't want to transition across to your other staff members, other than building them up and saying that they're very good, I've trained them myself, were there any other strategies that you use to facilitate them seeing other clinicians?
I mean, it's really difficult. It is really difficult when they've been with you for like a decade. And just gaining trust, as I said, listen, I've taught this person, and blah, blah, blah. Sometimes, if, for example, I was sick or I was away at education, we would just say to the patient, you can wait 2 weeks to see Kelly, or we can bump you over to the other nurses. And they would go, okay, I'll see the other nurses. And then they'd be happy with that. And now, sometimes I think in my head, I've not saw that client for a long time, and I look it up in the clinical software, and it's because they now go to the nurses. So it's very tricky, but it's definitely worth it. It's worth just, going through that. The other thing as well is the nurses would do the dermotherapies. I only took on a dermotherapist last year. So that's a good way of gaining trust, is that, okay, you don't want them to do your toxin or filler, but they can do your skin needling or your dermaplaning, or they are, she's a skin guru, she's amazing at chemical peels, and then they'll go for the chemical peels, and then they gain trust, and then they say, okay, I don't mind if you inject my face.
Yeah. Okay, so you kind of didn't give them a choice. They kind of had to see that person for one reason or another, and then you built the trust with the dermotherapy side, and then eventually those relationships are built. That's amazing. So I guess we might sort of have one last question. And I guess thinking back on your journey, what would be the biggest piece of advice for someone? This is going to be a two-parter. Someone starting their journey in aesthetics and setting up a business, and then growing a business.
So starting up is basically make sure that you are confident and competent in the skills that you have. Build your clientele first, and make sure that you've got that good patient portfolio before you develop and expand.
So good training, good foundation training and knowledge, and then nurture those relationships.
And like I said, go to everything that you can. I mean, we have so much. I get an invite to education every week now in WA, which is great because that wasn't happening a decade ago when I moved here. And, and a lot of this education it's free. So there's, it's obviously funded by the pharmaceutical companies because they want you to use their product, but you can always pick up tips and tricks. And as a clinical trainer, the same as you, Kelly, I love clinical training because I'll be like, oh, I didn't do that way, even 15 years later. So yeah, definitely get confident and competent with these.
Hands, hands.
Hands and eyes. Make sure that you are good in your health and safety and your first aid and your CPR, and you can look after someone acutely as well. Because as we said, we've had an influx of cosmetic nurses and doctors who are just out of uni, and I don't agree with it, to be honest. I feel like most of us old ones have went into this as a vocation, and okay, cosmetic nursing and medicine is fantastic, and we want to show people how amazing it is, but just get some general experience.
Yeah. Build on your clinical, medical, and nursing knowledge first before you enter the
Absolutely.
industry.
Yeah.
I think APRA has put those steps in place now. So what about for growing a business? Any tips, any final tips to grow a business?
Just don't go out and buy all those fancy devices and think that social media will sell those to patients, because it's not going to sell those to patients. What sells those to patients is you, and they trust you. So when you buy a device, you tell your patients about it, or like I said before, you ask them if they would be interested, then they will trust you and they'll have that. Seeing these devices, people going out and spending $200,000-300,000 on a clinic setup, sometimes more than that, having every device, all this equipment, and it just sits there and gains dust.
Yeah.
So, that's some people, I know that there's successful businesses that have done that and they have used that as their business model. But me personally, it's like, grow slowly, with competence and confidence.
Yeah.
And your patients will be attracted to that.
Yeah. I like that. So grow your skill, invest in yourself, invest in your skill, spend some time learning the basics, find the right people, and then slowly add devices as your client base and your staff and all of that grows. So that's been really good. Thank you, Kelly. Well, thanks for sharing your journey with us. And I'm very excited by your new adventure with the second clinic. So thank you very much.
Okay, thank you. Thanks for having me on.
Yeah. Okay, so that's it from me today. Hopefully you felt this episode was helpful. If you guys are looking to start or deepen your skills in aesthetic medicine, I do highly recommend exploring the HealthCert University Assured Aesthetic Medicine pathway. There are certificate courses, they're CPD accredited, and they're designed for real world practice. They have practical one-day workshops and they're held throughout Brisbane, Sydney, and Melbourne. They have both live demonstrations and hands-on injecting. And then if you're ready to take things further, we can offer one-on-one personalized mentoring with myself in Brisbane or in other places. And maybe Kelly will be able to offer some stuff for us. So you get to focus on the pace, the level, and we make it practical and safe to build your skills. So like Kelly said, investing in yourself and in your skills. So thanks for tuning in, and we'll see you next time on the Aesthetic Shift.